look at the infertility epidemic with like our age. We had the low fat stuff happening and the birth control, which alters our microbiome, which is going to impact our blood sugar and cause a lot of nutrient deficiencies. So we were truly like the first generation that's ever dealt with that. Like I will have like protein reseed days for people.
Okay.
So it's not like we're totally low, the body's not getting the essential amino acids. But some people, when they're very severely insulin resistant, I might have them just have fat at night. So if you're force feeding yourself 60, 75 grams, 100 grams of protein in each meal setting to get to a certain goal.
Are people doing that?
Totally.
Now, what might a typical snack look like? I mean, they're not just chewing on a hunk of butter. If we're kind of removing those carbs and removing that protein, what are some options that you'd recommend? Thanks so much for being here today.
Hi, good morning. Thanks for having me.
Yeah, absolutely. Well, I guess it's somewhat morning over here, but it's probably afternoon for you.
Yes, it's afternoon for sure.
Yeah. Awesome. Well, thank you so much for being here. I'm really excited to explore this conversation. But before we do so, you are a naturopathic doctor and you specialize in foundational and lifestyle medicine. And today we're going to really explore blood sugar and your approach working with clients on blood sugar and, you know, how it's even a precursor to healing the body, why it's so important. And if we don't address blood sugar, what ultimately could happen from it. But before we even get into that, what got you started in this field? I feel like a lot of individuals who are passionate about health and well-being generally have their own story. So I'm curious to hear what yours is.
Yeah, I'll try to make it the express version. But essentially, I come from a family of doctors, of MDs. And I dealt with my own health issues as long as I can remember. I had debilitating anxiety as a child. And it really stemmed from having ear infections back to back, antibiotics back to back, all due to a dairy allergy that was not even a thing, you know, in the mid 80s. So fast forward, you know, still having the debilitating anxiety in high school, having to leave class, you know, all the time, just really impinge on my quality of life and, you know, being handed medication after medication and never really, and then of course being thrown on birth control, which only impacts the microbiome even worse. Right. And so, all these things, all these layers, having pregnancies and depleting my body even more, having breast implants, which cause more, stress on my body. Really, I just got to the place of overwhelmment and just feeling like I'm dying, like I'm literally dying. And, which a lot of people around me didn't understand because I looked technically like, okay, like unless you're hung up in a hospital bed, people are thinking, I mean, she can walk and talk. She's fine, right? So, needless to say, with the whole breast implant illness, I was introduced to functional medicine. At the time, I was working on my doctorate. Anyway, so when I learned about the gut and I learned about toxicities and how that throws our body and how our body holds on to those things and just our environment in general, how that impacts our, you know, our internal health, I just became fascinated. And I was like, I have to, for one, heal myself along this journey, but I have to learn everything I can to avoid someone else's, for them to avoid their pain and their journey being as long as mine. And that really is my driver. And I get to a place of health and then I'm like, I bet it can be better. You know, you're just like, then you're just like learning and growing and you're just like, it's not out of a place of like obsession. It's just like the healthier you get, the more you're like, I forget how terrible I felt. Like, and if this is what alive feels like, I wonder how many people are still stuck in that place that I was and they think that is normal. So I just became obsessed and I'm a perpetual student. I will learn everything I can, whether it's about, you know, natural medicine or the subconscious or tying in everything together. I just love life and I want to learn everything I can. I want to help as many people as I can.
I think that's so fantastic. And I think that pursuit of knowledge and that driving force, I mean, once you go from, I don't want to put words in your mouth, but like rock bottom, just feeling horrible, not thriving. You don't feel optimal. And then getting to this sound place where you have the opportunity to thrive. I get it. You just want to learn, grow, and help other people feel the same thing. And, you mentioned something, and I'm curious, when you said you started, you were getting your degree and you were exploring gut health and you were learning more about that. Were you learning about that on your own end, or is that something that they were, going over in school? Because I'm hearing, a lot of times you go for your MD, they don't teach you, maybe not. Well, yeah, they don't teach you a lot about nutrition and inflammation. And so I'm curious, was the gut health and the exploration of that from school, or is that on your own?
Gut health was, a lot of it was my own. It was not a part of naturopathy at all. Like, not even a thing. It was more on the functional medicine sphere of things when we were looking at how to read the gut test and things like that. So, you really have to seek out information. And that's, it's really interesting because we're going to be talking about blood sugar. There is no good practitioner course on blood sugar. There is really not. And I might be the one to make one. I don't know. It's kind of in the works, but, it's on my mind because there is a need for it. And there are lots of, gut, courses and things like that, labs that you can run, but we have to consider it's not always just about getting, just put this probiotic in. Just take this bug out. So much of it is our soil, right? Like our gut starts with our soil. So it's connecting with our local, our farmers, our local food, our seasonal food, things like that. And eventually building the gut to a place where you are maintaining it with actual fermented foods and not just staying on probiotics forever. So I try to focus more on like a foundational approach to things because probiotics will only work as long as you're going to continue to take them. Fermented foods will feed and nourish that microbiome and make it robust. And so we can't forget that like there's a time and a place for the therapeutic approach, but we have to be building the foundation the whole time.
That's so funny you say that because I feel like that is something that is so deeply ingrained in my own healing journey. There's a time and a place where we need to use Western medicine and surgeries and whatnot, but if we're not using diet, lifestyle, supplementation as the foundation, you're not going to have longevity. You're not going to have this optimal healing. And I don't know, this could be a little bit counterculture, a little bit, can't think of the word. Mom brain so hard right now. Long night. But I think when we're, and I've done gluten-free, I've done keto, paleo, I've done all these things. My mom's celiac, I've removed everything. Is that the answer? Like removing all these things. And to your point though, is our foods aren't the same anymore. If we even want to call it food, it's stuff that we're putting in our bodies. And you look at, European cultures where some of the food that we have here isn't even allowed over there. So we have to look about what we're putting in the body. And is the answer removing all these, gluten or dairy, or is it just the stuff is no longer gluten and dairy? It's just so manufactured, so processed. And I think that conversation of the depleted soil and getting back to the roots. And I think this like homesteading, trend is starting to pull this stuff up. Yeah, yes, it might be a trend, but people are starting to make food for themselves and starting with baby steps, whether that's sourdough bread or their own kombucha. It's baby steps getting us in that right direction.
Yeah, we have to totally, we have to, you don't learn these things until you're put in a situation where you have to, and so if the way the food culture has gotten in this country is making people wisen up and be like, hey, I've got to take this into my own hands. What a beautiful opportunity, And so we can't always look at the doom and gloom and the avoidant, fear concept of things. It's like, cool, we get to connect back to our food. That's amazing. Like, let's celebrate that point of it and control what we can.
And I think that perfectly transitions into my next point of your focus in your bio. You even mentioned, naturopathic functional medicine with an emphasis on mindset and lifestyle. What does that mean? Because I don't think I see that on a lot of, it's more of like, let's talk diet. But the fact that you discuss mindset and lifestyle what came about for that?
Yeah. Well, when I first started as a practitioner, I was very much like protocol driven. Like, all right, you take this supplement for this thing and then you balance this and you do this and that. And then I would get to a point where you'd be troubleshooting, right? You'd have clients that either couldn't take supplements or couldn't respond to supplements, or they weren't responding, right? Because maybe their cells were stuck in cell danger response, or their cell membranes had been damaged or something like that. And you're like, or you're not focused on like the blood sugar component, which we'll get into, or like other factors that are constantly keeping them in a state of inflammation. And you're like, these supplements aren't doing anything to these people if the lifestyle is not going to be suited for where they're trying to go, right? Their future goals. And myself included, it was something that I was very much like, I was, only taking the supplement. When I was healing, I was only taking supplements. And so, you would get so far, but there's still some things. I was still like 40 pounds overweight. I had detoxed everything. I had healed everything I could heal, still overweight. I'm like, this doesn't make sense. I eat cleaner than anybody else. Mm-hmm. Like, you know what I mean? So I knew there were missing links. And part of it for me too was being in a place that's sunny year round, like being connected to the sun, being more connected to nature. Like these are all things that we forget about. Not everybody can move to, a tropical place. I get it. But foundationally, we have to be able to make sure that our lifestyle is supporting our goals. We can't just say, hey, we have this, it's the same as taking a medication for something. We're muting the symptom when the symptom is really saying, hey, you need to connect back, get your butt out there and get in the sun. You need to put your feet on the earth, connect with like we said, your local food supply, things like that. Those have to be foundational, because if they are missed, you will have to redo things and you will have to go back, because the supplements or medications or whatever it will be can only get you so far.
Absolutely. And, you hear the saying, you can't out exercise a bad diet. But I think to your point is you can eat as organic, biodynamic, fermented, all this stuff. And that's the direction that we want. We want to eat as clean, natural, or, back to our roots as possible. But if you are living with so much stress and your nervous system is overwhelmed and you're highly stimulated, you are driving in the car with traffic and a podcast going on and kids if there's so much going on, you have to balance and you have to look at your environment and your lifestyle as well. Because,
yes,
to your point, it's, you can do all these things right. But if you're not working on the external or the environment and lifestyle, you might not find healing. And, for some that might seem overwhelming. Like, where do we even start? There's so much information out there. What are the first steps that I should start looking at? And specifically in regards to blood sugar, if you have a client coming in and, they're feeling, maybe they have some adrenal stuff. They don't know what adrenals are. They're holding on to excess weight. They feel tired and wired. They probably are having a high carbohydrate or highly refined diet. Where do you start with them?
I try to meet individuals where they're at, because it would be so easy for them to tell them everything I do. But this has been a lifetime journey for me, right? Like my 15 years in is way different than their first year in. So you can't, and I always tell them, I'm like, you can't change everything overnight, and that's okay, because you have to pivot and shift as you turn, because then you'll know what's working. Then you know how it's serving you, and you're going to want more of that. You don't want to be in resistance to something that's completely on the other end of, what you would do. So if I first look at what are they doing right now? If I can get them to track, if they really are, it's a weight loss resistance or a metabolic issue, if I can get them to track their blood sugar, that's just even more data that we can go by. And it's that mind-body connection. When they see their symptoms are corresponding with their blood sugar spikes and dips, then they're like, oh, it's very empowering, because then they realize it's not at random. Their sleep doesn't suck just randomly. It's because their blood sugar is dipping like crazy all night long and waking them up. So I like to empower people. I could tell them all day long what's happening, but when they can see it with these tools that we have, it's very empowering situation.
Those tools that you mentioned, I'm curious, are you working with a CGM with them? Are they just doing the prick? What do you have them on?
Ideally, I like a CGM because so many people are being affected at night. So to have that overnight trend is so empowering. Because most people are eating their biggest meal of the day just an hour or two before bed. They don't understand that it's keeping their body so inflamed and so heightened all night. So for them to see that, I'm like, usually a CGM is going to give you the most valuable data. So I'm like, even if you can get a prescription or get it for just a month, just get a baseline, it's going to be so powerful.
Absolutely. I think to your point, just a month, you're going to learn so much through that time and maybe even experiment. My mom, my colleague and I had CGMs, cause I had severe hypoglycemia. I would go into the 40s on a regular basis. And so I had a CGM for a long time before they became readily available, but we just picked it back up, especially during the season to try it out and experiment with different things. So I haven't put it on yet, but fun. There are subscriptions out there. There are companies out there, testimonial levels. Which companies do you utilize? I use
NutriSense. They've been so good to me. I love it. It's very easy to navigate. So I love it.
Absolutely. Now, I struggled with nighttime hypoglycemia, but for those of us listening, and you mentioned, understanding what your blood sugar is doing at night, what kind of symptoms might they be experiencing where that might pull them back to, this could be a blood sugar related issue?
As far as the nighttime situation or all day long?
Nighttime specifically.
Nighttime. Okay. So this was one of my biggest red flags. When I first wore one a few years back, it would alert me and be like, wake up, like you are super low. And it was really scary. And somehow we're trained and maybe it's that we've seen on the worst end with like type 1s, right? Like if their blood sugar goes low, like, get something that's carb, high carb, fast sugar really quick. Like that's our knee jerk. But actually, if you think about it, if you're not type 1, that's actually going to perpetuate your symptoms even worse, because if you're going hypoglycemic, that means your body doesn't know how to burn fat when you're not bringing carbohydrates in. So if you bring carbs in when you're having a hypo attack, you are dropping blood sugar even lower because insulin's going to sweep in, and that's what drops our blood sugar in the first place. So it just perpetuates that cycle. If you keep saying, you're out of sugar, I'm going to give you more. We still don't become fat adapted if we keep fueling as just a sugar burner.
Absolutely. And, I know for me, one of the major symptoms was waking up in the middle of the night, like out of breath, feeling like I have a panic attack, sweating.
Yes.
And I know a lot of it has to do with cortisol. Are there any other major symptoms besides waking up that people might have? This could be a blood sugar related issue.
Yeah. So the waking, for sure, waking to use the restroom is a sign that your body's dumping excess glucose. So that is a thing. Racing thoughts. Let's see, the night sweats for sure, like the flushes, those can definitely, tinnitus. If you're laying in bed and the ear ringing is a thing, that can be a thing. Even, vivid dreams can sometimes be a blood sugar thing because your body can't get into the deepest state of sleep. So you're stuck in that REM. So you're way more aware of your dreams. So there's lots of like little nuances to look for, as a practitioner. And unfortunately, these things aren't very much taught. And if you don't have a CGM, you can't even see what's happening overnight, so if you are waking, and you're like, I don't know what's happening. They just keep giving me Ambien or magnesium or whatever. There's obviously more going on than just like you need a sleep aid.
Okay. And so we have somebody who uses a CGM, is starting to see, my blood sugar is dipping. What is something that you would advise to them? Maybe, how do we adjust our nighttime meal, snack, side proportions of it, but also what we're eating? What would you advise for them?
Yeah. So, one of the first things I do to help control an insulin situation, a blood sugar situation, is getting just them to eat within 3 meals, no snacks in between. because we want to get insulin down. We are a very insulin dominant society because we're eating, we're getting a Starbucks, we're snacking again, we're eating lunch, another Starbucks, whatever it is. And our insulin never has a chance to fall. We are just constantly insulin dominant. And so if I can at least lessen that insulin response by having them eat within their meals, no snacking, that's where we start. On top of that, I have them eat more as the sun is up, because as the sun starts to set, you become more insulin resistant. So that food is going to impact you way differently the second part of the day than if you had it for breakfast and lunch. Cortisol's higher in the first part of the day. And if you are skipping meals around that time, then you're really doing this blood sugar dance and you're not even eating anything. So you could be gaining weight just by skipping breakfast or lunch. So it truly is about fueling your body at the right time, tapering off. I want dinner to be like snack sized. I want lunch to be dinner sized. Like, get most of your calories by lunch, make lunch a dinner portion, and then you'll naturally want less for dinner. So whether it's the meal size, less carbohydrates, depending on the individual of how much do we need to fine tune that dinner, but I always have them start by moving it up. Because I say, I at least want you to get 4 hours without food before you're going to bed.
Okay. That's great to know. Now, what about, for instance, I host a boot camp at my house every Monday night. A lot of individuals, whether you're working out in the morning or you're working out in the early evening, they're going to have dinner afterwards. And especially if they've worked out, they might be hungry. You know, what is the size? Is that still a snack size? Are they introducing more carbs? What's that macronutrient profile that's going to be best for them to set them up for success for a good night's sleep?
You know, that's a challenge because, you know, when I tell people sometimes, because I'm trained as a personal trainer, like I know the nutrition aspect that trainers are giving and that sort of thing. However, when you're dealing with people with blood sugar and insulin issues, to tell them to eat more at night is going to be working against their efforts to heal that place, right? So that if you get ample calories throughout the day, do you have to eat after that workout? And the answer is no. It's really not. And people may not like to hear that because we're really taught like, oh, you got to fuel your work. If you're not a triathlete, you'll be fine. You know what I mean? You have plenty of calories before, you'll be fine. And if anything, it'll get you into more of a metabolic state to go into at night. Because you burn through some excess glucose stores. Why would you want to replenish those right before you go to bed?
Absolutely. And I think that touches into your lifestyle component is if your main struggle is blood sugar imbalance and dysregulation, and it's starting to affect every other area of your body, it might be a consideration to move your workout. If you're super hungry afterwards and you want to eat, maybe we move our workout to earlier in the day, or maybe we take away the workout and, you know, reduce the intensity of it, you know, looking at, I think it would be nice to modify and adjust and tackle everything. But I think we have to like pull the biggest lever of what's going to move the needle further. Totally. And so I love that you looked at that and maybe, okay, so you do an afternoon workout, you have a snack size afterwards and that's your dinner. And so would you recommend kind of a key player with all the macronutrients, protein, fat, and carbs? Or, you know, what do those levels look like as far as macros?
For like that dinner situation?
Yeah, dinner snack for somebody, but for somebody who does have blood sugar imbalances, they have metabolic issues, they are trying to lose weight, they don't want to give up the workout. You know, how do we find a approachable way of going about this?
Yeah. Well, this is highly individual. But in general, I first start playing with the carbohydrate load, especially towards the evening hours. People think they can tolerate a lot more carbohydrates than they really can. And there are certain ones that are going to really set you off versus others. So finding the ones that will work best for you are going to be, you know, the most valuable. So having that data is really great. The other thing though, and this is going to be quite controversial, is that a lot of people have to start pulling back on protein to fix their insulin resistance.
Yeah, I'm interested to hear because there is a lot of information in so many different directions. No, I think this is a safe place. I'm like, I think ultimately, and not everybody's like so aware of what's going on in their body. I'm somebody who like, okay, how do I feel with this? Especially going through severe hypoglycemia. Like I know what's going on. I know what's about to go on. And I really pay attention to how I feel. What's my energy like? What's my skin look like? What's my stools look like depending on how I eat? And so I think it is individualized. If you're eating 30, 40 grams per meal, but you're feeling sluggish, or if you're eating 15 grams and you're starving afterwards, there is that delicate balance. So yes, I am asking these like very specific questions, but it is so, this is why you have to work with the practitioner, because everybody's bodies are unique. Everybody's scenarios, situations, stress levels, lifestyle is unique. And so I don't anticipate we're going to get a one size fits all kind of answer, but I am curious.
Yeah. Well, and that's the thing too, is like, there's such I notice if you've been in the health industry or the fitness industry for long enough, you see these trends, right? Like, high protein, no low protein, high fat, no low fat, and like it goes up and down, it goes up and down. And there's such a push for this overconsumption of protein right now. There may be a season for it for some people. Like, let's just say if we're trying to rebuild neurotransmitters, you need to have tyrosine. You have to have more animal protein, in that case, that sort of thing. However, if you're trying to heal your gut, or if you're trying to correct insulin resistance and you're force feeding yourself protein 6 times a day, that also will elicit an insulin response. And so protein does spike your blood sugar, and this is highly individual as to how much or how often. It will help stabilize to an extent, right? Like if you're having protein and carbs together, will it lower that response from carbohydrates? Yes. But fat is the ultimate stabilizer. It is like a flat line when you see your insulin response from fat. So everybody is perpetuating that protein is the stabilizer, but it actually is, and there's only a certain amount, and this is individual as well, that your body can use towards protein synthesis before it's going to transform the leftovers into glucose and process it as a carbohydrate. And so we have this threshold, I would say on average, 30 grams of protein. So if you're force feeding yourself 60, 75 grams, 100 grams of protein in each meal setting to get to a certain goal.
Are people doing that?
Totally.
Because I've heard, so I was curious to hear your number, because I'm like, okay, I know 30, especially in the morning, protein first and have 30 to 40 grams. So I was curious if you were going to throw out like, okay, 10 grams, that's our optimal range. What is that? So 60 definitely sounds, overkill. What would be an appropriate level for that, snack before bed, or kind of, your dinner that's snack size?
In a really severe insulin resistant person, I would go as low protein as I could to start. And that sounds kind of extreme. I know, but you're replacing it with fat. The other thing too is like, we have to think about insulin resistance is usually coupled with really low hormones or erratic hormones. And so fat is the backbone, the foundation to rebuild hormones, right? And so, we're trying to get our blood sugar stable overnight. That's also when we're going to be repairing and restoring and healing.
Yeah.
So what better macronutrient to give your body than some fat, right, at night, so we can start to rebuild hormones and cell membranes, like we were talking about, all of those things. So it really depends on the individual. And I cycle in and out of protein. Like I will have like protein refeed days for people.
Okay.
So it's not like we're totally low, the body's not getting the essential amino acids. But some people, when they're very severely insulin resistant, I might have them just have fat at night. Very low in the protein and carb.
Now, what might a typical snack look like? I mean, they're not just chewing on a hunk of butter. No. If we're kind of removing those carbs and removing that protein, what are some options that you'd recommend?
Yeah. So I like a full fat coconut yogurt, something like that could be really great. And what a great benefit to your microbiome to be eating that at night, versus a huge steak and a baked potato and, all these other things, which might be healthy, but might be too much for you if you're trying to heal from insulin resistance. So I'm a huge fan of, coconut milk yogurt. Maybe like an avocado, with some egg or something like that could be really beneficial. You just really want to find your threshold. And like, if you can see, like we were talking about with the CGMs, like what is my threshold for protein and carbs at night? Like what will kind of put me over that? Sometimes sometimes if you're trying to heal insulin, maybe you skip dinner, you have a huge breakfast, a huge lunch. So you're not like restricting calories per se, but if you're really trying to get insulin to drop off, it's not bad to, of course, timed around your hormonal rhythm to skip every now and then and make that fasting window a little bit longer. You just don't want to do it every day.
Yes. And I think that's where the information is so valuable. And we have the ability in this day and age to see what's going on inside our bodies. And that's exactly what a CGM is. I know we've thrown that term out, but if you're listening, you're like, I have no idea. Continuous glucose monitor. So diabetics will have that, but then they also have their insulin pump. But it's now something that's readily available for anyone. You do have to go through and get a prescription and you put it on. It connects to an app on your phone and you can see second by second, minute by minute, what your levels are at. And, I'm not a good guinea pig because I'm kind of like with you. I'm like, I want to eat as healthy as I can, what works well for my body. But my colleague, she's like, I'm going to try, chocolate cake and walking after an apple cider vinegar. Like she's a great guinea pig and you can experiment and see what happens. But, maybe try the avocado, see what your levels are doing at night, seeing what you get an Aura ring, see what's going on. Are your numbers and maybe even journal. And I'm not a big journaler, but I think when you're tracking stuff like this, it is good to pull back and see, okay, what did I eat that day? How do we make that connection? So it is very individualized. Now you mentioned balancing blood sugar is so important, especially before we optimize and balance the rest of our hormones. What do you mean by that?
We have to understand that hormones function in a hierarchy. So we have to look at the very top of this hierarchy. Otherwise, we're trying to fix the effect and not the cause. So if we're trying to just fix thyroid, sex hormones, anything like that, we have to understand that those are impacted by cortisol and insulin. And so if cortisol and insulin are dysregulated or erratic, of course we're going to see symptoms of thyroid. Of course we're going to see estrogen dominance or androgen dominance, whatever that looks like. So to truly correct that, we have to find balance in the HPA axis. We have to find balance with what's happening with the cortisol and insulin response, because that is a driver, right? And if we can't get that in a homeostatic place, we can't expect to have optimal results from our hormones to follow.
Absolutely. No, I think that's so important. And I remember seeing years ago, and correct me if I'm wrong, but the cholesterol is at the top, and that's what we need to have adequate level. And that can be a whole other conversation of LDL, HDL, and do we really call it bad and good? I mean, there's so much controversy on cholesterol, but how we need adequate levels of cholesterol because that's what's going to help make our hormones. Right. So making sure, to your point, we got to work our way up and make sure we're optimizing up here so that everything else kind of trickles out appropriately.
And just to make a point on that, look at the infertility epidemic with our age. We had the low fat stuff happening and the birth control, which alters our microbiome, which is going to impact our blood sugar and cause a lot of nutrient deficiencies. So we were truly the first generation that's ever dealt with that. But we had a lot of things going, and there's still a lot of women that are still scared of fat. They're terrified of it. Mm-hmm. And I will say, you don't want to be high fat and high insulin, right? Because that's when you're high storage mode and then you're trying to eat a ton of fat. And if your insulin's not in check, is that going to go straight into storage? Absolutely. But you want to be cognizant of okay, what am I building right now? I'm trying to build hormones up. My hormones are tanked. My adrenals are tanked, cortisol, whatever. You have to give it the backbone that it needs for those things. And that's essential fatty acids.
Absolutely. And, if you're listening and you're you just feel overwhelmed. I don't know where to start. This stuff is resonating, but you don't know what you need to do. This is why I think it's so important to work with a practitioner, because they're going to do the blood work. They're going to be able to explore what's unique with your body. I didn't find out I had PCOS and Lyme disease and all these other things until I switched over to a naturopathic doctor, because they fought for, I mean, I went to other doctors. I mean, I found out I had SIBO, H. pylori, C. diff, all these things, all diagnosed, and Blastocitis hominis and Candida all at once. And then he's like, I want to keep, like, one of my lab works came back negative that I didn't have Lyme. And he's like, I don't know. I don't trust this. This doesn't seem right. And he's like, I want to push for another one. He pushed and we ended up finding out with the second round that I did. And so it's like, find doctors that will fight for you, that will work hard, that will, keep testing to figure out what's going wrong in the body, because unfortunately our lifestyle, our go, the stimulation, the foods we're eating is not setting us up for success. And so we have to get at the root of everything. But another thing that you mentioned that I found, and I will definitely link your Instagram. I loved your Instagram, in the show notes, but one component that you touched upon is the connection between liver health and blood sugar. And I'd love to explore that, what you mean by that. Why is liver health so important in regards to blood sugar?
Yeah. So this post apparently got a lot of conversations stirred up. We'll just say that.
Nice way of
I don't
it.
read my comments. Yeah, I don't read my comments, but I have a team that does that for me. We're so focused on the liver as far as just toxins. Like, oh, my liver's stuck. I gotta detox. And like, some people can't even tolerate any sort of detox things, right? Or they're jumping on the strongest of the strong, and they're like, or they're starting to see gallbladder issues or whatever. And they're just being told, oh, your liver's just stuck. Like, you need to detox it. What's really important to know is our liver is also managing where things are going. Like, are we creating more glucose because our blood sugar dropped too low and cortisol is telling us to make more, release some blood sugar, release some glycogen? Or are we frantically trying to store sugar because there's too much in the bloodstream, or insulin, or both, right? So the liver does so much more than just detox us. It's also balancing and regulating what's happening with the excess, glucose, the excess insulin, all those things. And so that's why I'm like, if your liver's stuck and you've done all the protocols and all the detoxes and taken all the supplements, you need to look at what it's doing, right? You need to look at like what it's actually like regulating for you. And if your blood sugar is doing this all day long, every day, and even at night, then for one, it can't detox at night. There's no way it can't get to that place of balance. And for two, it's being severely overworked, right? And then eventually we'll see things like fatty liver, but that happens way later down the road. The body's showing you signs way before that happens, with your hormone imbalances, with your, stuck liver symptoms, when it really is kind of boiling down to what is that regulating for me and how do I support it?
Yeah, I like that you mentioned that. And it's interesting. I was listening to, I don't know, it was a podcast recently talking about how fatty liver used to be something that only older alcoholics struggle with. And now it's becoming an epidemic with young children. And that makes sense, because if we are just inflaming our bodies and our liver with just so much insulin and glycogen, your liver is going to take the hit and you end up with this fatty liver. And I also love that you mentioned this, that sometimes we want to just dive into the deepest detox, but there's so many things we got to do before that, or that might not even be the right direction. For somebody who's listening, who's, okay, I feel like I need to give my liver some love. I don't drink. I'm trying to do all of this to the best of my abilities. How do they practically start supporting their liver?
I always tell people the very first step is always going to be stopping your exposure to things that would be bogging down the liver, as far as, endocrine disruptors, toxins in our food and our water, right? Our home supplies, our beauty supplies. But I'm finding that more and more people have already done that, or they're in the process of doing that, which is great. So that, that has to be step one, because, I'll have people come to me and I'll be like, I'll look at their toxin load, and they seem to have cleaned up some things, but their water supply is still garbage, right? And I'm like, your body's mostly water. That's how we flow things in and out, like nutrients, toxins, things like that. So if your water supply is still toxic, you're still getting so many exposures, right? So that has to be primary.
So what would you recommend for water supplies?
There's only one water system that I would ever support, and it's called Spring Aqua. It is a filtration based on your zip code, and it also structures your water and hydrogenates your water. So there's no electricity involved, because I know there's so many like Kangen waters and alkaline waters and things like that. But electricity changes the structure of the water, and it makes it not bioavailable to you. So you have to use the sun. You have to use filtrations. You have to add minerals back into your water. We could have a whole discussion, but if you can't buy that system, spring water is your best, your natural, best step. And then making sure you're filtering your showers, because that's a huge exposure that we don't think about.
So that was something that I was going to ask. Is this Spring Aqua? You said it was called Spring Aqua. Is like the name of the company. Mm-hmm. Okay. So is that just your drinking water, or does that, if they come in and redo the entire house, does that?
It's not a whole house system at this point. It's like a drinking water, like we use it for cooking. It's attached to a sink, so it's not on the shower. So we still filter our showers. Just because, it's a whole other exposure that like we're hot in the shower, pores are wide open, and we have all these halogens and pharmaceuticals and heavy metals just flowing all over our body. So you got to stop that exposure. I use a Berkey filter for the shower. But I know Berkey just rebranded, but still, I think you can still find the shower filters.
Well, and you even think about the shower curtains, the plastic shower curtains, if we're using, especially, I don't know if it's a women thing that we love, like scalding hot water where you walk out and you're like red, like lobster. I'm one of those. But you think about if we have a plastic shower curtain, what that's emitting.
We're breathing it in. Yeah, exactly. Yeah. Empowerment over fear, right? The more we know, the more we can control, and like with like making empowered decisions, like, okay, what's a bigger deal here? Like, when I'm drinking, what I'm like putting on my body is the most important. Our skin is our largest organ. So we have to be sure that we are taking that into consideration. So that, and then, on top of that, you could do some castor oil packs, which what that does, a lot of people don't understand what that mechanism is, but it really is just kind of opening up the common bile duct. Most of us have gallbladder issues before it's really blamed on the liver, because our bile gets really toxic and sluggish from all of the hormones, from all of the toxin loads, from a stagnant lymph situation, dehydration. So if our bile can't flow freely, then we can't detoxify properly. So we have to make sure that we can support that. And you can do that really easily. So think a castor oil pack, infrared heat, whether that's a sauna or, red light therapy, whatever that is. Obviously, the sun is the best option. You can't out hack that. But those can all be good, like gentle ways to support the liver. You could even do some, milk thistle tea, ginger tea, things like that, that will get and stimulate some of your detox pathways.
Fantastic. I feel like, and I'll add this in the show notes of all these different resources that we can apply. And, you mentioned such a pivotal thing. If we only think liver and toxins, but there's so much more. And, I'm still working through, my makeup to clean everything up, but there's so much that comes at us on a daily basis of BPAs here, endocrine disruptors here. You have to be so aware and empowered to, okay, I'm going to remove this out. I love what you just said of empowered over fear, because it's almost a full-time job to make sure that we can remove this stuff out of our lives. And I think that's where a conversation with your family, making sure that everybody's contributing, if that's the common goal to make this clean household. We have to start doing baby steps of what can we start doing on a regular basis that we start, removing and maybe saying no to the receipt papers when you purchase something, because the BPA is on it. Yeah. But there are an endless amount. So to your point, empowerment over fear. Now, next, we were kind of chatting about this a little bit before. So this season is all dedicated to blood sugar. Next season, gut health, which I think is such an important issue. And if you've probably got blood sugar issues going on, or you're on birth control, or you're on all these other things, chances are there could be some gut issues. do you have a certain, sorry if you can hear my dogs, is there a correlation in your eyes between blood sugar imbalance and gut health issues?
Absolutely. Some of it's derivative of just being in that chronic state of inflammation, so if the gut's inflamed, your whole immune system is going to be responding to that because, essentially like the leaky gut situation, anything that we eat, right, is going to go through our intestinal membrane and go to the bloodstream and create a systemic immune response. So we have that working against us. But there's also a specific microbiome that we could be deficient in, like Akkermansia, things like that will make us more prone to insulin resistance. So, our degree of insulin sensitivity or insulin resistance is highly, impacted by our microbiome status. And that is passed down, right? That's passed down from mom because you mentioned kids, right? And of course, it's the sugar and the formulas and the snacks and the puffs and all this crap that we give kids because we think they need to eat every hour. But also whatever mom's microbiome was doing at that point, right, when she gave birth is also going to be with. So we do have this, and until we're just now kind of really reeling in the gut health component of things, but we have lots of generations that weren't really thinking about that or understanding that part of it. And so we've got a lot of deficiencies that are being passed down and we're trying to kind of like recoup and rebuild, from that. But yeah, there definitely are connections with, our pathogenic to commensal bacteria balance and how that can impact how certain foods are going to impact our blood sugar.
Absolutely. And, you mentioned earlier on, like introducing more of these fermented foods, because these aren't foods that we're normally used to as, at least in the American culture or Western culture, that, sauerkraut, miso, kombucha, all these different things. I was actually, when I was pregnant, I was in a clinical study and there was different groups where you were randomized, you were either in a high fiber, high fermented, or high fiber and high fermented or nothing. And they looked at the microbiome of the mom and of the baby. I ended up not finishing at the very end because it was a lot. I was in the highly fermented group and I loved it. I was doing a lot of, Inner Eco is a company that I work with as well. And so they're a fermented coconut water. And so you get your pre, pro, and postbiotics fermented coconut water, and it's at Sprouts and all these stores. And so that was something that I could, regularly consume. Kombucha, I know that there's a lot of controversy with that while you're pregnant. But to see the benefits of the child based on your diet, and now even before when I was doing that and I had the high fermented, I don't think I was eating enough high fiber foods, but to see how both of those interplay with the health of your gut health of all these things, especially when I've had previous conversations. Sorry, this is going all over the place, but a lot of individuals who are having these gut issues or hormonal imbalance, there's a high likelihood that they had eating disorders in the past or a lot of restriction and a very traumatic. And, I think I've shared on this show, I've had 3 different eating disorders. I had a lot of medical issues growing up. And so that puts me in a place where now I'm playing a lot of catch up. How can I heal my body, restore, pull back the stimulation, pull back the intensity, give my body what it needs, the nourishment to recalibrate the central nervous system, all these different things. And so it does take some work because we put in some serious work to get here. But with all that being said, yeah, there's a lot of approaches to healing, and we have to look backwards of what we've done in the past to get to where we are now. And unfortunately, I know not everyone is blessed to have a vaginal birth, to be able to breastfeed. And if you were an individual that was born via C-section or all formula, there's probably a high likelihood of, ear infections and immune issues. And so even though that wasn't in your control, we got to take that into consideration and do everything that we can to support our well-being because we didn't have that maybe optimal situation.
Yeah, absolutely. It's important to know where you came from, right? In relationship to where you're headed. And a lot of people don't look at either, right? They don't know where they started and they don't know where they're going. So that's one of the first things that we talk about. We piece together and we have these aha moments of like, this is how we got here. Okay, cool. Now where are we headed? I mean, not a lot of people know what they want. They just know they don't want this.
Yes. That's a really good, that's an interesting way of phrasing that, of like what do you want? What does optimal living look like to you? And maybe that's even like, what's possible for you. You think about if you had the energy to play with your kids or your grandkids or go skiing or go on these trips. So maybe it's not just how do we get out of this like rock bottom, but what does thriving look like for you?
That mindset stuff. And then like, if we're not telling the subconscious what we want, it's just going to be reacting to everything that's coming at us. We have no direction.
Yep. How do we be proactive instead of the reactive? Now, before we wrap up, I wanted to pull out two of the Instagram posts that you mentioned. And I think if you're listening to this conversation, you might have a better idea of what you were referring to in here. Not you, the listener will have a better idea. But there's two different quotes that you mentioned, and I'd love to explore that or just take a few minutes to explore that. So one of them was, if it were truly just calories in, calories out, wouldn't we have had this whole obesity epidemic solved already? Let's kind of explore that a little bit of what you mean by that.
Yeah, totally. And this has once again been one of those things that I've learned through my lifetime and trained in different modalities, which all contrast each other, which is so crazy. I mean, one thing will say, oh, you got to balance blood sugar, eat every 2 hours. Another one saying, oh, you need to do that. And so, you have to trial and error it either personally or with your clients, you know what I mean, to really see what works. And that's what I really try to help people understand. The reason why your macros driven diet or your calorically driven diet is not working is because the body speaks in a language of hormones. And I just talked about this on Instagram today, so I'll save it. But we're so focused on the calories, and any female who's dieted, which it's almost insane with the percentage of women who has actually like been on some diet at some point. I think my first one was honestly when I was like 13, which is really sad, but here we are. And, the diets, if you're just counting calories, the only way you're going to progress with a calorically driven model is just by continuing to cut them. It doesn't do anything to our insulin. It doesn't do anything to our satiety. If anything, it creates more hunger, right? Because we're just dramatically dropping calories down. And so our ghrelin, our hunger hormones, going through the roof. We work out more, ghrelin's going even higher. Do you see how this like can perpetuate and then people are like, oh, why don't I have the willpower? It's like, cause you're freaking starving yourself and your hunger hormones are like, they're not feeling safe right now. And they're also set to that initial body weight, right? That pre-weight loss body weight. So until you get the body fat adapted and you teach it to switch between burning the food you eat and burning the fat on your body, you have to manipulate and play with that and teach the body, retrain it how to become fat adapted by getting insulin and blood sugar in check, which is a huge factor. And calorically, that is all just like, I'm not going to say calories don't matter, but the hormonal impact of them matters even more. I'm not saying you could eat 6,000 calories a day of pure fat and not gain any weight. So I'm not saying that, but I'm saying if you're, the other thing that I noticed with the calorie model is that when you start to come down in calories, like they're trying, oh, you're stuck here, you're plateaued. Okay, I'm going to cut this down. Guess what macronutrient gets cut first? It's usually fat. And we need fat for hormones. And so that's why a lot of women tank on this calorie model, because we keep tailoring down on fat, and pretty soon before you know it, you're on 30 grams of fat a day. Do you think that's enough for healthy hormones?
Yeah.
Not a chance. So you have to know that, when you get blood sugar and insulin in check, you can eat more intuitively, right? You can find your body's natural, what do I need? And the other thing is like, do we need the same calories every day? What if we're sitting all day? Do we need that? What if we walked, 10 miles? We need different, calories for different activities, different stress levels, things like that. And so to think that we should be the same every single day, it just doesn't work. Our bodies don't work like that.
Yep. Couldn't agree more. And for those of us that have been in the fitness industry or in the fitness industry, I think people are starting to realize that I'm hoping that calories in versus calories out, or maybe I'm just biased because I'm in this industry that I know that it's something so much deeper. But for those that have been immersed in the fitness industry if it fits your macros. Like that has been the biggest thing. You just follow this exact macro ratio, this equation, and you're going to get the ideal weight. Now, let's say you were successful at hitting the ideal weight. Have we looked at are they pooping every day? What their skin looks like? Are they literally screaming on the inside? Anxiety. They feel overwhelmed. They're not sleeping great. So the external body composition isn't a great indicator of health. And I would say there's a large majority of those individuals who get down to a certain body fat percentage, the period goes away. And, that's your hormones so dysregulated that it feels like it's in, your body has to hold on and fight. And, it puts us in a state of hundreds of years ago where if we were in, lions were chasing us and all this stuff happened and we're in these stressful environments. Well, we don't want to be making a baby right then. And so our reproductive system, the hormones, everything slows down and stops to be able to help your body survive. And that's what's happening. So if you're listening and you're struggling with amenorrhea or you lost your period, that's not a good thing. And I think years ago when I was struggling with eating issues, it was like, oh, cool, I don't have to deal with my period. But there's so much deeper and more underlying. And so if you're listening now and you're not in your teens anymore, you're in your 20s, 30s, 40s, and you still don't have your period or you're not regular, that's your body screaming that it's barely trying to survive. And that might be a time where we need to start feeding it more. There's so many individuals that I work with and clients and even family members who they're struggling losing weight and they tell me what they eat or their calories. And I'm like, you need to be eating more. Your body is just holding on for dear life. And so it doesn't want to get rid of fat because it's trying to hold it if it's in this starvation mode. And so we need to be giving our body that nourishment. But I get it. We've gone so long with this fear of fat and calories, but maybe just try it out. If you're struggling with this metabolic issue, if you're not losing the weight, focus on real food because that matters. Hormones matter, calories do matter, but stuff matters more. Focus on introducing real foods, not like, okay, I'm going to add more calories, but it's going to be pasta and refined foods. How can we add more vegetables? Stuff that existed 100, 200 years ago. How can we up that in our diet? I think you'll start seeing the needle move forward. And that could be scary for a lot of individuals, but maybe give yourself, I'm going to try for a month. I'm going to try adding in more calories, maybe earlier in the beginning of the day and kind of like wean out in the second half of the day, but seeing what happens to your body,
Yeah, definitely. Yeah. It's, you can't rebuild in a state of depletion, and so it's really important to make sure that you are giving the body what it needs to be in a place of stability and balance, and then it will work with you. But if you're always taking away from it, it's not going to like that. And then it's going to start holding on, right? Because then when you start feeding it normally, it's going to hold on to those things even more because it's afraid you're going to starve it again.
And I was looking at the second Instagram post I saved from you, and it's pretty much the same, but in a different way. There's too much focus on the calorie impact of food and not enough focus on the hormonal impact. So just kind of like nailing it in that we really need to be looking at what is this food doing to us and what are the carbs doing internally in the body? Let's go back to eating real food. Maybe because also if you think you have to be eating every 2 hours, that's not sustainable. That's not something that we want to be striving for. Diets aren't sustainable. Keto, to your point of like, I think there's seasons for things. I think there's a time and a place, but is that sustainable? Are you able to go out to dinner with your family and being able to sustain a form of eating, with whatever you're doing? I think that's something that we need to take into consideration and think a little bit more critically with. But yeah, I so appreciate you being here, Stacy. I think this was information packed. There was so many different insights. Anything that you'd like to leave the listeners with, or maybe even some first steps that they can try?
Yeah. I always say the more data you can empower yourself with, like we said in the very beginning, the clearer of a path forward you're going to have, right? And it can be overwhelming to some, but don't look at it as a fear. Like I'm going to test this food and I'm so scared. It's going to, whatever. Just look at it as like, I'm just learning what's happening because it's going to help me correlate this with my symptoms. So the more you can empower yourself with that, the easier your journey will be. And so that would be step one. And just realize that, if you can balance your blood sugar and your insulin, that is going to help you in any healing situation that you're in, whether you're healing your gut, healing your hormones, chronic infections, all those things, they all stem from chronic inflammation. And a lot of this inflammation is driven from what's happening every single day. So it's the most effective things are always going to be the simplest, right? Like the least sexy things. It's going to be connecting to your food, connecting to the sunshine, connecting to nature, like foundational things. Those are going to make the biggest impact. And it's just kind of finding what you're lacking and what you're missing and start giving the body more of that instead of taking more away.
So you're saying eating a Slim Jim while driving in traffic, listening to a podcast isn't going to set us up for success? I grew up on Slim Jims and Pop-Tarts. So, let's try to avoid that.
Sure.
Yeah,
Pop-Tarts
exactly.
for sure. Every cereal you can imagine.
Yep, exactly. And that was like bowls of it, starting your morning with that, probably ending your night with that as well.
Yeah,
exactly. Yep. Where can listeners find more from you?
Yeah, so I have my podcast, Biting Well with Dr. Stacy. I only am on, Instagram right now. I don't juggle a lot of other platforms. That's just the one I can manage. So Instagram or my podcasts are where you can find me.
Fantastic. Well, thank you so much for today's conversation. I think there's a lot that we could pull away from this and just give us that a little bit of empowerment that this is possible and it might seem overwhelming, but let's just start taking the baby steps.
Definitely. Thanks so much for having me.
Absolutely.